The Patient Advisory Committee originated in 2007 based on the fact that we wanted real-time patient feedback on what we needed to do to improve the patient experience in the cancer center.
Vasia had just come to us and asked us if we would be willing to meet and discuss just kind of what we had experienced when we were being treated.
We talked a lot, we laughed a lot, we discussed problems that affected us during our treatment, and the problem that I wanted to approach was the name change of the street.
When you would turn up to go to have your treatment, it just said cancer. When people would go to have their treatment, we didn't want them to see that. We wanted them to see something that was more encouraging. So we just kind of brainstormed and we came up with the name Hope Lane.
Over the last 5 years, our committee has really grown. Initially, we started with a group of patients, and now we have caregivers. We have a mother of a patient, we have a wife of a patient.
One of the things that I thought about children when they're waiting for the doctor to come in, I thought, how nice would it be to have TV screens in the waiting area? And the next meeting, they had already started wiring and putting up the TVs.
We raise funds through the Celebrate Today Fund. We help them to pay for lymphedema sleeves. We help them to buy wigs. We help them, those that live out of town who can't make it to their treatments, we'll provide them with gas cards.
Our continued mission is to provide the patients with the best care possible and to make that experience the best that it can be.
As a nurse, I've always tried to be an advocate for my patient, but you never quite understand their true meaning until you're the patient.
You know, it's part therapy and part patient advocacy, I guess you'd say.
We just want people to have their experience to be as good as ours and better.
If it's just a change to make one person have a more positive experience, if that's all we get accomplished, then we've done our job.
The SCORE team was developed out of the thought that if we want our patients to be happy, then we need to make sure our employees are happy. Every year, Press Ganey comes and does an employee satisfaction survey. With that survey, we see certain issues that need to be addressed. Well, the SCORE team will take each of those issues and try to come up with an action plan to help resolve some of these issues. With employee recognition, we do Oncology Warrior of the Month, which is like Employee of the Month. We try to organize events that are outside of work. Last fall, we have a corn maze here in Lubbock that we all went out and participated. We are organizing tailgate parties for our Texas Tech football games. And, it's just the little things like that where people can get together and get to know each other on a personal basis. And so I feel that's a big thing that SCORE does. It may seem small, but it's a big thing. It's exciting to be a part of a team that helps to take care of employees so we can take much better care of our patients.